after delivery, I delivered at 2. The baby was taken immediately to the NVU. So I actually didn't even know. But I had a question. The mother we were with during the delivery room, she was given her baby. I was not given mine.
Kuna kitu moja ili happen na nikafeel kwangu ni mbaya. Ile time mmetoka kwa penye mnalala kama mama juu mko different rooms na watoto wenu, alafu mnaenda kuna siku tulipata watoto wawili wamepass. Hiyo iliniumiza moyo kabisa, iliniumiza.
The neonatal period is one period where, in fact, now about half of all the people that will die, or the children that will die before the age of 5, actually now die in that first month of life. And actually, if you look at that half of all the deaths of under 5s in the neonatal period, 75% occur in the first week. And of those that occur in the first week, a large number occur on the first day of life. So the neonatal period has always been important, but as we've done much better at improving the survival for younger children and infants, particularly with vaccinations and better access to healthcare, the neonatal period has remained a real challenge.
Reflect of who is a newborn. A newborn unit is a very small baby. They can't do anything for themselves. So they are 100% dependent on people around them, their parents and the health workforce. The health workforce is the nurse who spends 24/7 with that baby. The mom, unfortunately, we don't have family-centered care in our setting. So the mom will come in every 2-3 hours, feed the baby and go away. But a lot of the times, it's the nurse who is left with that baby. So if you really don't have this critical workforce in these spaces, then we've lost sight of the care delivery that is needed for those babies. And they also have very many demanding roles. If you think of a sick newborn, then a lot of them will probably be on oxygen. They have an IV fluid. They need a drug to be given to them. They need to be changed. They need to be turned. They need to be fed. And all those things are dependent on someone. And that person is the nurse. So they really play a critical role, but I think a lot of the times we haven't recognized a lot of what they do.
From the challenges we face as a unit, in a newborn unit, first we have shortage of staff, where you get your nursing that 5 babies per one nurse, which the ideal way is supposed to be 1:1, 1:2. The other one is burnout. With the shortage of nurses, we face a lot of burnout, shortage of supplies, lack of motivation from the county or even our administration.
When you have so many babies to look at, then you don't have this time. You feel pressured. You really feel pressured. Even at a point you just can say go, you just stand still and now see here grace. May God grace take over and now give me whom will I prioritize. Yeah, you feel so pressured. Going home you feel burnout.
In a shift where one nurse is taking care of up to 37 babies, it becomes difficult for the nurse to focus on those tasks that require soft skills. And most important is the communication and the psychosocial support to the mothers. Within those settings and within those working conditions, it's possible then for the nurses to pay attention to the clinical aspects of care. So things like providing medication and treatment and documentation tend to take the forefront. And by the time the 12-hour shift is over, they don't have time to then spend talking as required to the mothers. And therefore, the communication and the psychosocial aspect of care then gets left behind. Not because they intend to, but because of the work pressures and the nurse-to-baby ratios and the high workload that they have.
Kĩndũ kĩa mbere kĩrĩa ndambire ndaingĩra mũrango-inĩ wa mbere nurse ũrĩa ndakorire ambire.
When I got to the door of the newborn unit, the nurse shouted at me, apparently because I was carrying the urinary catheter wrongly. But I did not know how I was supposed to carry it since no one had told me how to. I went back crying. I even thought about leaving my baby at the hospital and going away. I also remember she grabbed my breast saying it has milk, demanding I should express.
Kama amenishika matiti, ananiambia hapa kuna maziwa, hapa kuna maziwa, furuta.
A big company was looking at the medical side of it, the human resource side of it, but an important actor in all this is the mother. It's important to view them not just as people who we are offering services to, but recognizing that they're also playing an important role through their contribution to some of these interventions. They perform kangaroo mother care, they're the ones who are breastfeeding and feeding the babies, and therefore they're part and parcel of providing care to these newborns. And most importantly, when the babies get better in the newborn unit, we are sending them to the community who takes care of them once they leave the hospital. It's the mothers. And therefore to get their input and participation and sort of to support them so that by the time they're leaving the hospital, they have the skills and they're capable and confident to care for their babies post-discharge.
The workforce shortage, and particularly for nurses, it's an urgent problem. We cannot assume that it's business as usual because, there's still someone who shows through the door and provides care. There's someone who is paying the price, as I said. It could be the patient, that we lose them, unfortunately. It could be, the nurse themselves. It could be the system. So it's urgent because there's a lot of momentum towards building better hospitals, giving better equipment, making sure the medication is there, but who's gonna deliver the care? I think the example I always like giving is if you have two babies that need to be resuscitated and there's only one nurse, really, you can only resuscitate that one baby. So we need our leadership to recognize that staffing is critical. If you don't have people to, it's like a government investing in fighter jets and not having fighter pilots. Really, the enemy will still crush you. So it's the same thing. We can't build hospitals by equipment and not have nurses.